Incremental lines. We will speak about 3 different incremental lines of dentin. First one, von Ebner. It is the incremental lines which appear as fine lines or striation in dentin. It runs at right angle to dentinal tubule, so dentinal tubule in this direction, and the incremental line at right angle to it, and correspond to the incremental line in enamel or bone. So it is a normal happening lines because of daily deposition of dentin. It reflects daily rhythmic recurrent deposition of dentin matrix as well as hesitation in the daily formative process. Hesitation means at some time secretion of matrix slow down and at another time it becomes fast. So it reflects the daily rhythmic deposition of dentin and hesitation. The distance between lines vary from 4 to 8 micrometer in crown to much less in root. So we can say that the speed of formation of dentin in crown is faster than in the root. The course of lines indicates the growth pattern of dentin. When studying these lines, we can understand how dentin grows. Incremental line of Owen. It is sum of incremental lines accentuated because of disturbance in matrix and mineralization process. When disturbance happens during dentinogenesis, which is matrix formation and mineralization, it will be reflected as incremental line of Owen. Readily demonstrated in ground section and are known as contour line of Owen. We can easily see it in ground sections. Analysis with soft X-ray has shown these lines to represent hypocalcified bands. So the disturbance happened is hypocalcification of these areas, which reflected as lines. Neonatal line. We can see it in deciduous teeth and in the first permanent molar. This line separates the prenatal and the postnatal dentin. So we can just see this line at the teeth which was developing at the time of birth. So we will find it in the deciduous teeth and the first permanent molars, where dentin is partly formed before birth and partly after birth. This line reflects the abrupt changes in the environment that occur at birth. As we know, the feeding mechanism changed to the fetus after birth. So these changes in feeding and all environment reflected as neonatal line. The dentin matrix formed prior to birth is usually better quality than that formed after birth. Because dentin formed during pregnancy, not subjected to the environmental changes, so it is better quality.